Jeffrey Skubic. Dr. Skubic is currently serving as the Interim Trauma Medical Director at DHR Health. He is board certified by the American Board of Surgeons in both surgical critical care and general surgery, and is the first surgeon in the Rio Grande Valley to have completed an acute care surgery fellowship. He earned his Doctor of Osteopathic Medicine and Master of Science in Musculoskeletal Medicine at the New York College of Osteopathic Medicine at the New York Institute of Technology, located in Old Westbury, New York. His general surgery residency was completed at the University of Arizona College of Medicine in Phoenix, Arizona. He then attended Harvard University, the Brigham and Women's Hospital, to pursue a fellowship in acute care surgery/critical care. Dr. Skubic has been a recipient of many awards and is an active member of the Pan American Trauma Society and the Eastern Association for the Surgery of Trauma. He is widely published in peer-reviewed medical journals. He specializes in trauma surgery, emergency general surgery, and surgical critical care. He currently spearheads the trauma department and partners with surrounding hospitals and first responders to improve the care of trauma patients in the Rio Grande Valley. Dr. Skubic is involved with conducting research in trauma and strives to bring innovative treatments to improve care for traumatically injured patients. He has practiced surgery in various South American countries in conjunction with the Pan American Trauma Society and is currently faculty for UTRGV, where he trains and mentors future surgeons. Please enjoy the following interview featuring Dr. Skubic.
Hi, welcome everyone. My name is Dr. Elisa Alvarado with the Region 1 Education Service Center. And today in our interview corner, we have Dr. Jeffrey Skubic, who is a trauma surgeon at DHR Health. A little bit about the PATS project for those of you that are not familiar. PATS stands for Pathways Aligned to Health Science, and it's a TEA Federal Perkins grant through Region 1. Currently, we serve 10 districts, and today we have La Jolla, Vanguard, and South Texas ISD joining us. I'd like to welcome Dr. Skubic, and also I want to get some insight from you regarding how you got to where you were, and also insight for the students on how they get to pick their pathway. So to get started, my first question is, where are you originally from?
So thanks for having me today on the PATS project, Dr. Alvarado. I'm originally from a small town in North Jersey called Haledon, New Jersey. It's a 1 square mile borough on the north side of the city of Paterson, New Jersey, which is about 10 miles outside Manhattan. It's basically the New York City area. And I grew up there, went to school there, and eventually went to college in Newark, which is another large city in New Jersey. How I went about going there, when I was really young, about 5 years old or so, I wanted to be a surgeon. And then as the years went on, I kind of forgot about it. I kind of drifted away from it. I don't know if it was laziness or just lost my way. And then in high school, I actually didn't even want to go to college. But the guidance counselors, I actually switched schools my senior year. It's a long story, and I switched from into a school where the guidance counselors, I remember them, they took me to the other school I was in didn't have guidance counselors. And so my first week at the new school, it was a better school, they took me to their office and said, so what'd you get on your SATs? And I was like, essay what? And they're like, you're a senior, you haven't taken your SATs? So they forced me to do it. I'm like, okay, I'll do it. So I took that. They said, after this, you're going to sit in our office every week until you fill out these college applications. I was like, all right. So I filled them out. And I wound up going to New Jersey Institute of Technology, which is an engineering and science school in Newark, New Jersey. And after that, I actually didn't go right to medical school. I actually worked as a year for an engineer while I took my entrance exam, which is called the MCAT. And at the same time I was taking that, I was applying to medical school, and I was studying at night for the MCAT.
So your undergraduate degree is in engineering?
Computer science.
Oh, computer science.
Which is not a common thing.
So when you were going to school for computer science, did you know while you were taking the computer science courses that you wanted to do something in health science, or you wanted to be a doctor?
So about halfway through college, at the same time I was already working at that small engineering company part-time. And I would look around me at work and realize that these guys would be older guys towards the end of their middle or end of their careers. And they were still sitting in the exact same cubicle for the last 25 years. And I had a very hard time sitting still. And so I really started to look around me and go, do I want that to be me in 30 years? And so I realized I don't want to do this. I don't want to just sit at a desk all day. So I started thinking about what else can I do? When I was younger, I wanted to be a surgeon. Is it possible? Can I go to medical school? And I didn't think it was possible because I didn't have any money. And I didn't know that there was ways to get the government to help you pay for it and all those things. So same thing with college. Because I was coming from a single parent home and we didn't have any money, I was actually able to get a number of grants. I think Perkins grant, I think a federal Pell grant. And I was able to get almost my entire college paid for. I think I paid just a couple $1,000s for all 5 years I went. But it was about halfway through college, I realized, you know what, I'm gonna try to see if I can go to medical school. So while I was still finishing my computer science degree, I started taking the pre-med classes at the same time at Rutgers University, which was across the street from NJIT.
Oh.
I could walk over. We were allowed to take classes there for free if you were enrolled in either school. They're kind of joint schools. So I started taking them at the same time. It took me an extra year to finish, but at the end of 5 years, I finished all the pre-med requirements and the computer science degree.
Oh, wow. And you're a pretty young trauma surgeon, because when I was talking to Elizabeth that works in the education department, she said, oh, you're going to be interviewing a trauma surgeon. And I thought, I'm going to be interviewing someone a lot older. How old are you?
So I'm 38 years old. I was
Wow.
born in 1982.
38.
38, yeah. So the pathway was, because you're probably like, well, how long does it take then?
Right.
Well, I only finished all my training about 2.5 years ago at age 36. So once I made that decision that I was going to go for medical school, I finished college and worked for a year while I applied. And then once I got in, actually, my applications kind of got screwed up. Remember, my school was an engineering school. Really, not a lot of people go on to medical school from there. And the doctor that was in charge of, he was a chemist, was in charge of keeping all the applications, actually disappeared suddenly for a few months, and I couldn't get him to send in my letters of recommendation. And later I found out it's because he was having glaucoma surgery.
Oh, wow.
Anyway, so obviously they weren't really set up for it. So when he finally got the letters in, I only got one medical school interview. But I went on that one interview and I was like, well, I only need one. And I got in. So I took it. And then then I was able to get mostly federal loans. I guess it's all federal loans to pay for all of medical school.
And where did you go?
Cheap. I went to New York College of Osteopathic Medicine in Long Island, New York. And I went there for 5 years. Again, I'd spent an extra year. The reason the extra year there was I got into like a TA program where I was able to help tutor the younger medical students, and they helped pay for the last 2 years of medical school.
Oh, wow.
And so that helped a little bit, and I also got a little bit extra experience in doing research and teaching. And while I was there, one of my friends told me I should go try working in South America, in Ecuador. So I started looking into the hospital he recommended, which was a big metropolitan hospital in Quito. And I discovered this guy named Edgar Rodas, who was quite an amazing man, who was a surgeon from Cuenca, Ecuador, came to the United States, did all his training here, worked here for a few years, and then realized he wanted to go back to Ecuador to help his country. And he built an operating room on the back of a truck and was driving into the most remote Indian villages in rural Ecuador in the Andes. And I didn't think it was real, so I wanted to go check it out for myself. So while I was a medical student, I flew down there, and I spent, I think, 5 weeks with him the first time, just traveling around the Andes Mountains operating.
And did you, were you already bilingual, or where did you learn Spanish?
Yeah, I grew up with Puerto Rican friends in New Jersey, and so I could kind of already speak Spanish.
Oh, wow.
Not medical Spanish, mind you. So there's no better way to learn the technical words than to work in it. Because I can still remember the first time we were operating on the truck, they're asking me for the tools in Spanish. I don't know any of those technical terms, because who uses, the word for scalpel talking with your friends in the street?
Yeah.
So I learned all those on the fly, but you never forget, right? It's under high pressure. So, and working in the hospitals down there too while I was down there. And so in that environment, you learn how to speak the proper technical words very rapidly.
Wow. And so after that, how did you, I guess, end up or decide that you were going to be coming to work in the Rio Grande Valley? I mean, how did you hear about this area, or what brought you here?
Yeah, no, that's a good story. That's a good question, because it's a remote place down here too. And so that was my first experience. I didn't have any interest in that kind of thing, operating in rural. I knew I wanted to be a surgeon, but I didn't know what kind, and I didn't know doing what. And but after I worked with him, I said, "Wow, this is amazing. You can go to remote areas and really help people." Mm-hmm. And so after I finished medical school, then I went to do residency at the University of Arizona in Phoenix. And part of the reason I wanted to go there so badly was they had a lot of different rotations, including sending you 3 different times to go work at the Alaska Native Medical Center in Alaska. And so you got to go work with native populations in Alaska and do operations up there. And you would go there for 2 months at a time and work. So I got a lot of good experiences there working in remote areas. And also Arizona, there's a lot of transfers in from Indian reservations all around the state of Arizona. And that's when that's when I started to think about, well, if you're out there operating, great, you can help one person at a time. But if you can change a whole system, such as creating a trauma system, you can help hundreds of thousands of people and change so many lives. So that's when I started thinking about doing trauma. And also my residency was very trauma heavy. And so I started thinking about trauma, which is basically taking care of people that are involved in an accident, gunshot, stabbing, falling down. Any kind of traumatic injury is what we deal with then.
Wow. And so you saw the opportunity on here online, or you heard about the Valley through somebody that you knew, or?
So then I went to Boston to do my fellowship for 2 years in critical care and trauma surgery. And while I was there, we started looking at job offers, and this one sounded interesting. I was actually recruited by the UTRGV in 2018 to come down here, and it just sounded like an interesting place, and when I came down here, they kind of pitched it to me as it's a part of the United States that doesn't have a level 1 trauma center yet, even though there's so many people here, and we're trying to recruit academic trauma surgeons to help build that.
And what does level 1 mean?
So, there's hospitals and there's trauma centers. A trauma center is a hospital that can take care of really badly injured patients. And then there's different levels. A level 1 trauma center means you are the type of hospital or trauma center that the worst injured patients that come to you, you take care of them from admission all the way to getting them home. And you don't have to rely on any other hospital or sending them out. And the tradition here in the Valley for a long time was, we can deal with minor injuries, but anything major we ship to San Antonio. And what we're acting as now and hoping to get certified this year is an actual level 1 trauma center, which means we don't send out anybody. We already don't send anybody out, except for burns. But to get verified as that means you are the leader of the region as far as taking care of trauma patients. Just like they have in San Antonio, there's 2, or in Houston, or Dallas, or any other big city, the Valley deserves the same level of care. It's basically definitive care for any possible injury you can get.
Wow. So currently, right now, if somebody were to have an accident, there's no hospital in this region that could take care of that at a level 1 trauma center.
No, DHR is functioning as a level 1 trauma center.
I see.
We're awaiting our certification. We're currently a level 2, but we are going to be doing our level 1 site visit this year.
Oh, wow.
And no, we would take care of whatever injury the patient had. We would take care of everything. We wouldn't transfer them out. Again, except burns and certain pediatric injuries, because it's really hard to get full coverage for all of pediatric, meaning adolescent or children subspecialists. But for adults, we take care of everything.
And so, I know in my experience, and I don't have a lot of healthcare experience, and I certainly don't have a lot of trauma experience, but, you know, they talk about this fight or flight reaction, and a lot of people that see trauma, obviously, you know, they get really scared, some of them faint, they hyperventilate. How do you do it with trauma patients? I mean, what goes on in your head that you're able to kind of not be absolutely frightened of the situation?
So I guess a couple things there. One was I had really good mentors as examples when I was a resident training how to do this stuff. I always admired the surgeons who were cool as a cucumber no matter what was going on. Guy comes in with a knife sticking out of his chest. They're just over in the corner. All right, you do that, and they're completely relaxed. And so I said, I want to try to model myself after those guys rather than the frantic ones. That doesn't help anybody. And two, if you want to be a surgeon, you can't mind blood. You know, a lot of people see the sight of blood, they faint. That kind of stuff it wasn't having to get accustomed to it. Never bothered me. When I was a teenager, I worked at McDonald's. That was my first job, and I always had to go and clean the slides and stuff if kids dirtied them, urination or other things. And I never thought anything of it. And the same thing with blood. And after a while, it's just like a mechanic. You know, if a mechanic's in there working on an engine, you know he's going to get grease and oil all over him and under his fingernails. He doesn't think anything of it. And it's exactly the same with a surgeon. If we're working on a body, we're kind of like a body mechanic. And there's blood all over the place. But to us, it's just like oil. You know, we're just working. We don't really notice it.
Wow. So what is your exact role at DHR Health? Like, do you just do surgeries? Do you work with a team? Do you work with other surgeons? What's a day in the life of?
Sure. So here, it depends what practice setting you're in. Here at DHR, it's more like a university setting. We have a team of residents and medical students that work on the trauma service. And so on any day, I direct a team of about 5 or 6 trainees that work under me. And as a trauma surgeon, we cover them from when you arrive at the ER, taking you to the operating room if you need to, or admitting you to the hospital to take care of you, or taking care of you in the ICU, all the way until hospital discharge, whether you go home or to a rehab. And we do that by having that team that I can direct all at once. And if you need an operation, we're going to take you to the operating room and we'll fix whatever it is, and then we'll take care of you in the ICU afterwards. So the trauma surgeon is kind of an all-encompassing jack of all trades, where I work between the ER to the operating theater to the ICU, and I can function in all those places. Most trauma surgeons are also board certified in critical care or in intensive care medicine, so we have privileges to work within the ICU as well as the operating room. So we can kind of work anywhere.
Wow. And do you see yourself being a trauma surgeon for the rest of your career, or have you thought of other areas that you may be interested in later on in your career?
Well, I can't really do anything else at this point. All in all, it was about, so I graduated high school in 2000, and then I did five years of college, then I worked for a year, then 5 years of medical school, 5 years of residency for surgery, and then a year of critical care fellowship, and then a year of acute care trauma surgery fellowship. So by the time I finished, it was the year 2000 until 2016 that I was done with all the training, and I was able to actually look for a job. And so after all that, you don't really know how to do anything else except that one thing that you're really good at. The other thing, other than improving the entire system of trauma here for the Valley, that I'm interested in is going back to the trucks again, because that's where I started. And I know DHR has a truck, as well as UTRGV has a mobile truck. None of them have operative capability at the moment. Some of them can do dental procedures, but eventually I would like to start using that to try to bring some operative care to the colonias. It's kind of what we were doing in South America. And if they can do it all the way down there, sometimes we would be 11 hours away from a city.
Wow.
We were able to operate on people. So why can't we do something similar here for the indigent population?
That's great. I want to ask for all of the students that are joining us today, what kind of advice do you have? Maybe tips or certain skills or anything that you would want them to know if they're interested in a career in health science, particularly if they're interested in a career in becoming trauma surgeons or working in trauma?
So, for all of the high school students out there listening, basically you can do whatever you want, okay? It's all up to you. You don't have to be the smartest person. You don't have to have amazing dexterity with your hands. People have this vision of surgeons that were extremely highly intelligent, and we have these hands that never move at all. I could basically train anybody to do surgery procedures. Anybody of average intelligence, I can train you to be a surgeon. It's more, do you have the dedication to train for 15 to 20 years after high school, unrelentingly, and not give up? If you can do that, little by little, we can teach you to be a surgeon. So, and we, as humans, actually, when they look at this, our DNA are actually very similar. We have very little differences between us. We're much more alike than we are indifferent. And so we're not just born to be surgeons. Surgeons are trained, and I can train almost anybody to do surgery. But it just takes countless thousands of hours of repetition and dedication to reading and studying and practicing tying thousands upon thousands of knots. And if you're willing to do that, we can train you. If it's a financial concern, you can get help from the government. I've never been given any money from my family at all to go to school. And I was able to go through all those years of schooling, all on grants and loans. Now, am I still paying them back? Yes. Am I going to be paying that back for many years? Yes. But it's possible. So you should know that whatever it is that your dream or desire is to do, you can do it if you stay dedicated to it, you don't give up, and ask people and apply. Come seek me or other surgeons as mentors. We can tell you how we did it. But don't let monetary reasons be a factor not to do it. I didn't have any money. You just have to take out a lot of debt. But it's okay. You can pay it back. Yeah. Oh, and the other thing is, don't be afraid of failing. I know you hear people say that all the time, but I stumbled and failed many times on my path. First year of college, I failed calculus the first time. And I thought that was the end of the world, and that was going to be the end of me. But I retook it, and I did okay. And so even if you fail a class, you can retake the class and keep going. Don't drop out or give up. As long as you keep getting back up and pushing forward, you'll keep edging your way along. And you just keep staying. And the other thing is, when you start this journey, it's going to look so far away, you're going to think that it's never going to end. And you just say, wow, if I could just finish all this, I would be done and finally be a surgeon. But then all of a sudden one day it was over with. And now I look back and I go, I can't even believe I went through all that. I'm not even sure I really went to college or not, but I guess it happened. It goes so short in retrospect. But you really can do whatever you want if you're willing to put in the time and take out massive loans. But they can be paid back, right? So
Absolutely. I want to thank DHR Health and particularly Dr. Skubic for being here today. And I also want to take the time to ask students that are listening in to go to our website and to email us any questions that you may have. Because what we want to be able to do is answer your questions and make sure that you got what you needed from this session. I know that a lot of times when we have interviewers, we're able to do live sessions, but what we want to be able to do is still answer your questions and get back to you as soon as we can. I also want to say that it was really refreshing to hear a lot of your personal story regarding the journey of you becoming a doctor, because I think that in my generation at least, and I know that we've heard from students, there's a lot of roadblocks, and initially when you hit the first roadblock, your first I guess like your first reaction is to say, okay, that's not going to work. It's too long, 16 years. But I think that hearing stories like yours makes it very real for our students and inspires them to know that it is possible. And I particularly like the fact that you learned another language and you went to another country to offer your services. I think that that's amazing. So thank you so much for that. Again, students, thank you for joining us today. And as always, we'd like to thank our partners here at DHR Health for always accommodating and serving their community. Thank you.